Okay, today we're going to treat Jay here, and basically we're going to use our new high-powered deep tissue healing laser. Here we can actually pick the area of anatomy we're going to treat, and for Jay it's his wrist, so we click on the wrist, hand treatments, and we can pick which category. Now in Jay's case he has chronic wrist pain, so we'll pick that right there, and we're going to click on this area, and basically it tells us exactly what measurements we need to treat. And we're going to go ahead and start right here, and we got to make sure we got our goggles on. It is a high-powered laser, don't want to blind anyone. So basically Jay has had chronic wrist pain for a few decades. He even had a disease called Dupuytren's contracture, which is an idiopathic disease, which means there's no known cause or cure, which causes your tendons to just be permanently contracted. And he did have surgery on that, which helped release it. However, he does have remaining scar tissue, which this therapy helps to break up. All right. So he also has the carpal tunnel syndrome, which is caused by this band, this sheath of fascia which surrounds your tendons and nerves in your wrists, and that fascia gets overly tight, and that causes pain and numbness and tingling down the hands, all right, and wrist pain. Another thing Jay has is he has what's called decurvainous tenosynovitis, which is Latin for arthrosis of the tendon of his thumb. So whenever he bends it like that, it causes pain. So we're really essentially treating three different conditions here: the carpal tunnel syndrome, decurvainous tenosynovitis, and the Dupuytren's contracture, and all the related scar tissue formed from all those diseases. So what the laser does, it does three things. You can feel the heat.
No,
it's not as much now because we got on pulse mode.
Yeah.
So it's pulsing the light energy in your wrist so it doesn't get as hot, so we can treat you deeper.
I'm just cold, actually.
Yeah, okay, that's good. Now, what we want to do is we slowly slide the laser over the places we're going to break up the scar tissue. Okay? And what the heat does, it brings in heat for circulation and brings in healing properties such as oxygen and ATP, which the light energy does as well. The photonic energy penetrates the skin up to 5 centimeters, and it increases healing factors, excites the mitochondria, which increases oxygen, and it increases the healing factors and gets the waste products out. Tell me when you start feeling the heat. Yeah, you got a high pain tolerance right there.
Doesn't hurt.
That's good. Now, how did you feel after the first treatment?
Oh, excellent.
Yeah.
I really did. I went home. It was fairly miraculous.
And that was after having what type of therapies?
Well, I guess the more primitive machine. I don't know, the one that she did before.
Yeah, and that's what
4 minutes is all it was.
Uh-huh.
But I went home, and the next day there was even a quantum leap from that.
Yeah.
So
really,
before you felt better.
Before you came in here, what was your pain and discomfort level on scale?
Oh, it wasn't extreme, but it was a nuisance constantly. It was about 5 or 6.
Yeah, and this is the most relief you had compared to other therapies?
Definitely. I wouldn't be back here otherwise.
What other therapies did you try?
Oh, God, everything.
Yeah.
Heat, cold.
Pain meds, injections, surgery.
Everything over the years, yeah.
Wow.
I have arthritis,
Uh-huh.
really what I have in my wrists and hands, disfigurement. I just thought there was nothing I could do with it.
Yeah.
And I can't take pain pills because it affects my kidneys.
Exactly, and your liver has to detoxify it.
No, I was getting, what do you call it, the creatinine problems.
Yeah.
So I'm stuck with chronic pain. This was fairly miraculous.
Yeah, that's great. After one treatment, it's incredible.
Yeah. Oh, yeah.
And what I'm doing now is...
There's delayed reaction to it, too.
Yeah.
I guess it disturbed the tissue, and the next day it kind of settled. And
exactly, that's exactly how it works.
Yeah, I had a very pleasant reaction. I've already referred another friend, an old friend.
Wow. Now, what I'm doing now is I'm doing additional therapy to help break up the scar tissue. This is called ancient Chinese gua sha therapy. It's called a gua sha tool. It has different beveled edges. Some are sharp, some are a little smooth. And this is made of deer horn. And what we're doing, we're breaking up more scar tissue, and you can see how the skin's getting red. We're bringing in blood for healing, and Jay's going to go home and ice this to decrease any inflammation and carry away the waste products, and of course drink a lot of alkaline water to flush any toxins being released. Okay. I use other tools that are metal, which have different shapes, and that's also called Graston therapy. This is essentially Graston therapy, except this is made of the deer horn, so it's a little more comfortable in a way because it doesn't get cold, and it's a little more natural because it kind of has the same density as bone, so it feels more natural than the metal. You can feel that right there breaking up.
Yeah, I can feel
it. It feels like sandpaper, and this is all the adhesions that they just calcify over the years.
Oh, yeah.
It's kind of like getting calluses on your hands. Yeah. This is the same tissue that's in the joints and muscle and fascia we're breaking up.
I can't turn my hand very much because of it.
Exactly.
Yeah.
And so the scar tissue over the years just builds up and builds up.
If you can make it turn, that would be wonderful.
Yeah, until it disables you.
It's hard to shave.
Yeah.
Or anything where you have to turn your hand.
Yeah.
I can't even collect change from something. I look like an old man. I pull my shoulder around.
That's what this does. It helps you get back to normal function. Let's try this one right here. And this side as well. So basically, unfortunately, Jay has it bilaterally. But with this therapy, we can definitely double or triple the effects of the laser. Because the laser is basically for the photonic energy treatment. This is more mechanical treatment to break up the scar tissue. You know, we combine the two therapies, we really get excellent results, as you've seen. And then you had that thing right here too, right?
Oh yeah, that's what hurts. A little kind of knob there.
So right around this bone
right
here, he has a lot of scar tissue buildup, and as you can see, we can use different parts of this gua sha tool to break up the scar tissue.
It's really amazing.
Yeah. And it actually doesn't feel as bad as it may look.
I don't
right?
mind. I'm thrilled to death
Yeah,
to get something done about it.
We put an emollient on there, so
It's
there's
not
less
bad.
friction.
I don't
And
care.
this has the same, consistency of the bones, so it's really natural. All right. Okay, and how did your second treatment feel today, Jay?
Oh well, I can already feel something.
Yeah.
Yeah.
Looser, huh?
Uh-huh.
Yeah. Well, there you have it, folks. So this is, how we treat sports injuries, chronic degenerative arthritis conditions, tendonitis, whatever, myofascial complaints, chronic. We really see the last of the last. People who've tried medications, injections, surgeries, acupuncture, other physical therapy, they just don't work. So really we treat the last of the last. We are the last resort, and we do get 80–90% cure rate. So, if you have any of these diseases or anything, just give us a call for your 2 free trials, because we want to prove that it works before we continue.
The arthritis thing, I went to the arthritis doctor, whatever you call it, rheumatologist.
Yeah.
It's worthless. I could be a rheumatologist because all you do is just give aspirin out. So you got arthritis, here's your pain pill.
Well,
that's it. So get lost.
Well, basically, here's what allopathic medicine is, and it's not their fault, it's their training in med school. Here it is. You walk into the office, and you say, Doc, I got a stuffy head, I got stuffy sore throat, and I really feel like my nose is stuffed up. And then the doc will say, well, you have influenza, right? And then he'll prescribe medication for you. Here you go. So essentially you're paying the doc for what you diagnosed yourself, right? The symptoms.
Yeah.
He just told you what you had in Latin and gave you a prescription. And because the Latin word influenza, it sounds something, he diagnosed me as something special.
Yeah.
It's so that's what it is.
It's just worthless completely. Then they gave me so much pain pill that it affected my kidneys, so they backed off from it. So I was essentially left high and dry with pain.
And then by
this
the time
type kind of works.
By the time you retire, you got this whole medicine cabinet of medication.
Oh yeah, that I can't use.
And half of them are to counteract the side effects of the other one, and it's just no good.
Vicious circle. Yeah, vicious cycle.
All right. Well, thank you for your testimonial, and I'm sure we're going to help a lot of
It's
folks.
heartfelt. I'm not being paid for this.
All right, that's great. Okay, that's good.